Good evening. Welcome to Your Voice, Your Future, the first in a series of town halls where we discuss the issues that are important to you. Our topic tonight, can Obamacare work in South Carolina? For the next 60 minutes on WWMB CW21, we're going to take a closer look at Obamacare, or the Affordable Care Act. It was made law in 2010, and as the marketplace was introduced to people in 2013, it was marked by a disastrous rollout.
We fumbled the rollout on this health care. Fumbled the ball. We did fumble the ball. These are two fumbles.
From a broken promise that people can keep their insurance policies if they like them, to the fact members of Congress are given much better options for their own insurance under the law.
People are frustrated because they see a Congress that's living large, that's enjoying perks and benefits, and people outside the Beltway are cutting back.
Now the law itself could be unraveled by lawsuits. Michael Cannon, a healthcare policy expert, believes the 2,700-page law clearly defines healthcare exchanges as being established by the state, not the federal government.
I think it'll come down to what is the definition of a state, and is there a difference between the state governments and the federal government?
Please stay with us here on WWMB CW21, and also go to Facebook and Twitter and send in your questions. We're going to turn things over now to our moderator, Armstrong Williams. Armstrong?
On this very historic day, as we celebrate the 85th birthday of Dr. Martin Luther King Jr., we find it quite appropriate to host our first town hall meeting on a very important subject, affordable care. As the president stated in his opening that he fumbled the ball, but we also know that fumbles can be recovered. And we're here tonight to recover that fumble. Welcome everyone, and thank you for joining us. Let me introduce to you our very distinguished panel that has come to join to make sense out of this issue and never make assumptions of where any of our panelists stand and where they will end up before the night is over. You have a chance to influence them and make a difference. The Honorable Lovett Anderson, the Mayor of Lake City, South Carolina, is joining us. Mayor Anderson, thank you so much for being with us.
Glad to be here.
Terry Alexander, who's a state representative, thank you so much for joining us.
Good to be here.
The Honorable Tom Rice, your local congressman, thank you for joining us.
Honored to be here.
And Dave Swartz, Americans for Prosperity State Director, thank you for joining us.
Thanks, Armstrong.
And let me turn it over to my brother from another mother who will be handling the social media. You know our own celebrity, Tim McGinnis, Sher's brother.
Thanks a lot, Armstrong. Tonight, I'm going to be manning the social media center. That means anything that comes into Twitter or Facebook from you watching at home, I'm going to pass on to Armstrong, and he'll deliver up to the panel. So where can you find us? Go to Facebook, search News Channel 15. That's our Facebook page, and you'll see where to comment there. Or if you're on Twitter, our handle is @CarolinaLive, and the hashtag is Your Voice, Your Future. Let your comments and your questions come in, and I will pass them right along to the panel. Armstrong, back to you.
Thank you, Tim. Let's get this going. I have a question I want to ask, and I want you to respond by applauding. Is Obamacare working for South Carolina?
No.
Oh, wow. No. Oof. Wow, no, it's not working? No. I just want to make sure I heard it correctly. Wow. Let me pose that question to our very distinguished panel, and I'd like for you to answer that question by a show of hands. Is Obamacare working for South Carolina? Oh, okay. You guys seem to be in the minority tonight, but that's okay. Hopefully you'll be in the majority before the night is over. Congressman Rice and David Swartz, you did not raise your hand. Why? You didn't raise your hand. Why? Why is it not working?
I think Obamacare is flawed. I think the institution of it's been flawed. I think that, you know, heck, we had 150,000 people in South Carolina lose their insurance. We've had 24,000 people sign up on the exchanges. If the goal of Obamacare was to get more people insured, it seems we're backing up rather than moving forward.
Terry Alexander, obviously you have a strong reputation in this state. You care about your constituents. It seems as though, and this is a really well-mixed audience, and obviously they seem to think that it's not working. Why don't you share with us your perspective on what is working in terms of Obamacare?
Well, let us put it in perspective first. The Affordable Health Care Act has been in existence since 2012, not October of 13, but 2012 it went into existence. And let me tell you what that law is doing, what that law is doing immediately right here in South Carolina. Number one, any child who is under the age of 26 can stay on their parents' insurance. That's working. Anyone who have an existing condition that otherwise would not be insurable, that's working. It may not be affecting some of these folks in here, but if you have a child that's under the age of 26, he or she can still stay on their parents' insurance. And if there's a pre-existing condition that you were not insurable for before, you do now have that opportunity to be insured. So when you're talking about the Affordable Health Care Act, and you're talking about the Obamacare, you're really talking about two different things. And number three, South Carolina right now is receiving dollars and cents to exert the Affordable Health Care Act. What the argument is, or what the concern is, or the disagreement about, is the Medicaid expansion, which rolled out not so good in October. But there are other components of the Affordable Health Care Act, and those two which I have mentioned. Now our seniors do not have to pay as much in their deductibles as they once did because of the Affordable Health Care Act. So it is working. It may not be affecting everyone, but it is working. And not only that, the cost of health insurance has gone down, not gone down, has slowed down tremendously here in South Carolina. So those things are working, and it's working well.
Audience, anytime you have a question, you want to challenge, don't feel, just come, form a line, two at a time, and I'll take your questions immediately. You were writing down notes while Mr. Alexander was speaking. What are your thoughts on what he was saying?
Well, I'm glad that he mentioned some of these attributes, and this is the usual liberal talking points on this law. We hear pre-existing conditions. We hear about 26-year-olds being on their parents' insurance. Seniors, I'm very surprised that he mentioned. He didn't mention that there's going to be $700 billion cut out of Medicare, which is health care for seniors, that is written in the law. And Medicaid expansion. This is something that I have particularly, Armstrong, taken a real particular interest in. Medicaid expansion, which is the health delivery system supposedly for folks that make under a certain amount of income, impoverished folks, it's supposed to help them, and it doesn't. And that's the real, I think that's the real battle with Obamacare. Is Medicaid expansion. It's a battle here in South Carolina. It's a battle across the states. The Supreme Court said in their decision in 2012 that the states could decide whether they want to expand Medicaid or not. And let me tell you, this is a system. Anybody that's been involved in Medicaid can tell you it hurts the folks that need the most help. These are the folks that we need to be helping, but we're not. A third of doctors don't accept new Medicaid patients. So what that will lead to is longer waits to see doctors and a dramatic drop, a dramatic lowering of the quality of care that they receive. Folks, and I can just tell you off personal experience in Virginia, I know we met folks that were in the Medicaid program that recently they had to drive upwards of an hour and a half to see a doctor or a specialist because there was no physician in the area that in which they lived that would cover or that would accept Medicaid. That's a major problem. That's a loss of care. That's something that everybody should have access to, but you don't in the Medicaid system because it's so poorly run, and again, just hurts the folks that need the most help. So I'm not quite sure why a lot of these folks are advocating for the expansion of really a broken system.
Mayor Anderson?
Yes. Well, when we talk about a broken system, all systems have issues. And it simply means that it's an opportunity to fix a system. The delivery of it. Medicaid, of course, is for those that really need it. We're in rural South Carolina. We're not as dense as most populations are. And we've always had issues in regards to not having a large amount of physicians in our area. But I think that there are ways that we can enhance that. There should be incentives there to bring other doctors and medical staff to these underpopulated areas where there is a sole need or a real need to have physicians there to handle our Medicaid population. In the urban areas, it's the same. We as a state should look at ways to present opportunities to enhance our medical systems and bring folks here that will provide that level of care that our constituents need.
You know, before I go to our first question from the audience, I was reading something, audience, very interesting before coming over here. Of the 2 million people that have signed up for Obamacare, only 11% were uninsured. What does that tell us, Congressman Rice? Only 11% was uninsured.
Well, excuse me. I want to make several points, but the first thing is that the uninsured, even though they're insured before, are not pursuing Obamacare. And they're going to have to pick up the young, healthy crowd if they expect for the insurance companies to be able to afford to provide the coverage that Obamacare mandates. But let me say this. I would never argue that our health care system was perfect before Obamacare. And I would never argue that there didn't need to be changes to get more people insured. Okay, I agree with that. And I co-sponsored a bill, H.R. 2300, proposed by Representative Tom Rice, who is a orthopedic surgeon from Atlanta and an expert on healthcare law. And under his proposal, Obamacare does nothing to reduce the cost of healthcare, okay? Under his proposal, he reforms medical malpractice to reduce, so that doctors don't have to practice defensive medicine. That will reduce the cost of healthcare. He allows insurance companies to compete across state lines. That, by competition, free trade, fair trade, reduces the cost of healthcare. And then, you know, we've got the group that qualifies for Medicaid and always have qualified for Medicaid. And then we've got wealthy people who can afford their own health insurance. The people in between, a great deal of them work for companies that provide their health insurance. So we have to deal with the rest. And that was, you hear conflicting numbers, anywhere between 30 and 40 million Americans that were uninsured. What his plan does is provide a sliding scale of tax credits to allow people to go out and buy their own insurance policy. Now, the difference between that and Obamacare is where we have a problem that we have 40 million uninsured Americans. Obamacare doesn't just cover them. What Obamacare says is everybody in America has to go and buy an insurance policy that's designed by the federal government, that provides coverages that you may or may not need, may or may not want. For example, you're going to have to buy maternity coverage, and you're going to have to buy mental health coverage, and you're going to have to buy vision and dental coverage. These are coverages that, you know, in my business, I always carried major medical on my employees. Why?
Hold that point, Congressman.
No. Let me. But I never carried those coverages because we didn't think they were worth it. We never paid for it. We never needed it, and that will result in a higher cost across the board. I'm sorry.
Terry, hold that point. Hold the point. Let me get to my sister here. Where are you? What's your name?
I'm Sean.
Where are you from?
Maryland.
Okay. Go ahead. Take the mic.
Oh, okay.
And
Okay. I'm an actual licensed insurance agent. My niche is usually the senior market. And I was listening to you talk about some of the programs and what's not working. So my question is, what are some of the things that you think would be needed to improve the health care for seniors?
For seniors? I
or
think
the Medicare or Medicaid program seniors?
Yeah, well, I think the thing that will help solve, and this sounds simplistic, but it's the truth. The thing that will help solve and really cure a lot of what ails us when it comes to healthcare policy in this country is we got to get people working again, okay? We cannot have a sustained unemployment rate the way that we do. We cannot have a third of the population out of the workforce because health insurance, a lot of it is gained by employment. And when folks, especially in the middle class and lower middle class economic situations, have jobs, they have health insurance, that means there's less stress on programs like Medicaid, where then Medicaid truly becomes a program where the neediest get help. And that's what really Medicaid should be. It should be a safety net program. And the way that, that the president has written the law and the way that some of these states are implementing it is not a safety net program. They want as many people as they possibly can to have Medicaid, and that puts more stress on the system, that boxes out doctors, and that's when you get doctors that'll leave the Medicaid program. They no longer will practice. Like I said, a third of the doctors in this country no longer accept Medicaid patients, and that puts more stress on the system, and it reduces the quality of care. So, simplistic answer, really easy answer, let's put policies in place They get people working again. I mean, we need more jobs. That's the problem. That is the problem with everything that's going on in the country right now, but in particular, healthcare.
I want to be fair. I want to be an honest broker tonight. And I know, Terry, Representative Alexander, you want something to say, and then when you finish, then we're going to come to back to the audience.
Let me
Please.
address a couple of these issues
Sure.
here that I've heard come from my colleagues to the left of me, unfortunately.
Well, you never know.
You never know. You never know. Number one, I don't have to buy maternity insurance if I don't want to.
Well, that's not true.
Let me finish. I didn't. Hold up.
That's not
You
true.
have the choice. Once you go into that exchange, you can purchase what level insurance you want. That's left up to you. You can purchase what level insurance that you want, number one. So you don't have to have that if you don't want it. You get the level of insurance what you pay for. That's my understanding, number one. Number two, this whole piece about the federal government engaging in setting up this whole healthcare component. I served in the House of Representatives when South Carolina was afforded the opportunity to set up their own insurance exchange. We had the opportunity to do that. Matter of fact, it was $1 million that were given to the governor's office to set it up. To set it up like however way she wanted it to work, if she wanted it to work. So we had that option when you're talking about federal intervention. If we were to choose to do so, South Carolina would have set up their own exchange.
How's it going in Oregon?
How's
it going in Maryland?
I'm talking about South Carolina.
How's it going in these other states? It's disastrous.
I'm talking about South Carolina. We had the opportunity to set up our own exchange however way we wanted. And to say that this program is, if folks would go back to work, then insurance would come down, that's ludicrous. I know there are working people right now. Working people right now cannot afford insurance. 2 households cannot afford insurance coverage.
And this bill does them no good. The law does them no good.
What I'm saying is, but now they have the opportunity to go and search the marketplace out.
And they still can't afford it.
They don't have. Well, they have it and still can't afford it.
I agree with what you're saying. I don't think we disagree.
And I think
this isn't the solution.
Let me finish. And so what I'm saying is that there are some components that are out there that are working. Just say the whole process is not working. I don't think it's fair, because if you're saying it's not working, then all of those folks who are on, all of those folks again who had pre-existing conditions will not be insured. All those kids who are up to 26, they'll be thrown off. So those seniors would have higher deductions. So you're talking about that. So those areas there are working. Can it be better? Yes. We knew that. We know that from the very beginning. Doctors were leaving practice years ago, before the Affordable Health Care came in place. I know. I work with them. They were leaving the business because of high insurances that they had
Terry,
to cover.
hold your point.
Okay, just want to throw that out.
I appreciate your point. I appreciate the fire and the passion that you have. Your name?
Stacy.
Stacy, where are you from?
South Carolina.
South Carolina. And make your statement, ask your question.
Okay. What I wanted to say is that I have daughters that get nervous.
Come on.
Anyway.
I got you. Good, you're okay.
My point is, I have daughters that work. I work part-time. Since the law passed, all of our employers dropped us down, our hours down, so that 28, if not less hours. Couldn't afford insurance before, but now we're told we have to have it, but we can afford it even less. I don't get where this is helping.
Yeah, that was the point I wanted to raise earlier. The 3 most important issues in my district are jobs, jobs, and jobs. And one of the huge problems with this law is that it is anti-jobs. With the 30-hour per week limitation, where you're forced to carry coverage on your employee, people like their hours are dropped, they make less money at a time when the economy's down, and they can ill afford it. And then the second problem is the 50 employee limitation. I've had a number of people in this district. I had a fellow from Florence who had a couple of automotive-related businesses. He had 2 branches. He had 40 employees, and he wanted to open a third, but he wasn't going to do it because he would go over 50 employees. These things, they matter. They ripple through the economy. They stifle economic growth, and they stifle job creation. This law is a job killer.
Hold that. So what we're going to do, I hear the feedback here. You guys are really warming up. We We need that dragon with a little more fire in it. But what we're going to do, we're going to go to Tim McGinnis and get an update of what's going on with our social media.
Yeah, we're getting a lot of great stuff, Armstrong, through social media, through Facebook. Go to Facebook, search News Channel 15. That's our page. You'll see where to comment. You can go to Twitter. We're at Carolina Live, and you can use the hashtag #YourVoiceYourFuture. Just going to pass on a comment or two for you. Here's one from Terry Allen Speck on Facebook. He says, I'm 57, my wife is 52. The lowest health insurance for the two of us is $462 a month. How are we able to afford that? It does absolutely nothing for a senior citizen. And let's find one more on here. We do have a lot of great ones. Here's one. Paulette Baxley says, my dad is a single-parent household living from paycheck to paycheck. He looked at the OBC. How is he supposed to afford almost $900 a month with a $6,000 deductible? Keep the questions and comments coming in. I'll throw that back to you, Armstrong.
Thank you, Tim. Fonzie Lewis,
My question,
where are you from?
This is home. Conway, South Carolina's home.
Okay.
My question, I've had a condition for over 10 years and no insurance. I've tried and tried to get insurance. And the last time I got a quote, it was like $3,000 a month. Every time, I mean, this has been over and over and over. So without Obamacare, where am I going to get insurance that I can afford?
Well,
and I desperately need it.
yeah, there are ways to cover pre-existing conditions without Obamacare. And also,
$3,000.
South Carolina had a health insurance pool. I don't know if it's still in existence or not. I know because I had 2 kids with pre-existing conditions, and I bought insurance for them through the health insurance pool. And anybody could buy health insurance through the health insurance pool, and they couldn't be turned down. But you don't have to have Obamacare to cover pre-existing conditions. One problem, though, with that is that there are a group of people out there who will not buy insurance until they have a real problem, until they're headed to the hospital. And if that happens, that will break this insurance plan because insurance companies will not be able to afford to cover it. There are hospitals out there now that are signing people up for Obamacare as they enter the hospital. And the plan was not designed to absorb that, and it will not stand in the face of that cost. So there's a real risk with covering a blanket covering of pre-existing conditions. There has to be some kind of conditions on that. But no, I think there ought to be a way that you get insurance, and you can cover pre-existing conditions outside of the Affordable Care Act. And I know South Carolina had a health insurance pool because I had 2 sons that were on it.
And that's a great point. And I think we all are in agreement up here. You know, we want to give folks access to health insurance. I don't think anybody up here wants to deny anybody access to health care.
Affordable health care.
Absolutely. But the way that you do it, and State Rep Alexander, you mentioned, okay, we've got 26-year-olds that are now able to get on their parents' plan. You got folks with pre-existing conditions. Mr. Lewis's issue. Armstrong, you mentioned the 11% that were previously did not have health insurance. You know, why didn't we focus on those 11%? I think that if we just focused on the folks that really needed the help and truly needed the help, instead of this huge government takeover of health care, we probably would have had agreement. I think Republicans, Democrats, conservatives, liberals probably could have agreed to a common sense plan that would have helped folks like Mr. Lewis that clearly you need help. We need to get you health insurance, but we don't need some broad-based, government takeover of a sixth of our economy. I think that's where conservative groups like Americans for Prosperity really had the biggest problem and still have the biggest problem today is there was this broad paintbrush solution for a problem that probably could have been solved with, a fine point pen.
Something like HR 2300.
Exactly.
Let's get the mayor. Let's get the mayor because he's been awfully quiet. Well, so, Mayor Anderson.
When we talk about pre-existing conditions and we know how the insurance business is set up, they take a risk. What they always want to do is minimize their risk. Therefore, when we said it's a sweeping legislative act to include everybody, it's to lower the risk pool. If we get the younger folks involved who are healthier, who still have all this time on their hands and they're still young and spry, it lowers the risk associated with the insurance companies. Therefore, it keeps the cost down. That's the whole benefit of involving everybody is the bigger the pool, the less the risk.
But why should young people who are healthy, exercise, pay for older people who are sick and unhealthy, why should they bear that burden?
Well, it's a part of them being an American.
Is it?
Yes, it is.
When did
we are supposed
when was that
to, are we
introduced?
not our brothers' keepers and our sisters' keepers? We've got, as a nation of people, start looking out for each other. And this is what we start doing.
Socialism?
We are our brother's keepers, but the government shouldn't have to make us implement that.
And
if
we
don't.
sure are.
That's the bottom line.
We're putting a lot on our young people.
Most young folks now are paying into Social Security that they probably never received.
Yeah.
Right now, we have young folks paying into Social Security that they would never be the
We
benefactors
agree with
of
you.
it.
They'll get it if I have anything to do with it.
Well, you know, you never know, you know, but they will not be benefactors of it. So we're paying into a system. And this whole thing about big government, what about the people? 65,000 people right now in Horry County are uninsured. 65,000 in Horry County, where we sit, are uninsured. What are you going to tell them? The government is too big, and we don't want to insure you because the government is too big. What are you going to tell them?
So who's
no,
responsible?
we don't want to give them government insurance.
What we're going to say is we don't have to
We don't
run
give
the
them
government
Medicaid.
to get them insured.
You know, what's that? Mr.
Who's
Thomas?
responsible?
Well,
Is it government?
Well, you know, I was interesting. I was listening to this young kid the other day speak. He said, it's not our fault, but it is our problem.
Okay. You agree with that? You agree? Okay. No. Well, the majority of you agree.
It's not our fault, but it is our problem.
Okay. Your name?
Benita.
Benita, thank you for joining us. Go ahead.
I purchased insurance here in November because I couldn't afford to get it where my husband works anymore. It would have went up to like $210 a week out of his paycheck. Can't afford that. So I bought insurance. Apparently, it's Obamacare. I didn't buy it on the exchange. Bought it from a private insurance guy that came to the house. $695 a month for just me. $6,300 out of pocket.
According to Forbes,
The doctors are not taking it around here because it's an EPO. You cannot buy a PPO privately.
Yeah,
And the doctors, I lost both my doctors a week before my insurance took effect.
according to Forbes magazine, the average insurance policy in South Carolina is going to increase by 30 to 40% as a result of this law kicking in. And one thing that people don't realize is that, you know, the president said you can keep your policy. Well, clearly 150,000 people in South Carolina's policies got canceled. That was not true. The president said you can keep your doctor, but what you're finding out is that was not true either. In fact, of the four carriers that were approved to sell on the South Carolina exchange, only 2 of them allow you to go to the Medical University of South Carolina. So if you're on the half the plan sold in South Carolina, a South Carolinian cannot go to the Medical University of South Carolina and be paid.
Why are you letting the doctors get away with this? Why are you not doing something so they take the insurance?
What would you have them do?
Well, what can you do, Congressman? Wait a minute. What can you do? What can you do to change her plight? Is there anything that can be done?
This law,
can anything be done?
This law will not work. This law
But what can be done? It may not work, but can it change?
HR 2300.
Okay.
That actually attacks the problem of the 30 to 40 million uninsured people, rather than making 300 million people buy a bells and whistles insurance company that the government designed that will cost more than anybody's insurance. These substandard insurance policies, as the president calls them, those are defined as any insurance policy that anybody would actually want to buy.
Do you know why the doctors aren't taking your insurance?
Nobody will give me
Because
an
they
answer.
don't get reimbursed at nearly the rate that it costs them to take you as a patient.
But I'm paying $695 a month.
And so where's all that money going? It's going to the bureaucracy of Obamacare, right? We've got to pay all this money, and you're paying all this money to the insurance company and their plan because of. And again, the congressman talked about how, you know, as a man, I have to pick up maternity insurance. I'm sorry, state rep. There's no way you get to pick your own plan. There's all those mandates that you have to have,
Right.
and that's costing you more money. That's costing you more money. That's why your insurance is $695 a month. But the doctors, they get reimbursed at a 20% lower rate. If you're, I'm not sure what it is with the new plans, but in Medicaid, they get reimbursed 20% below cost. That's unsustainable. You can't have doctors expect doctors to take patients
It's interesting
for Medicaid.
Costs. Maybe what this is going to do, maybe it's going to cause the doctors to look at their costs. We already know that the cost of health insurance has stopped in terms of this rise over the last couple of years. maybe what's going to happen is going to have the doctors take a look at it and say, listen, we are charging extremely too much. And you know that. You know, you go to the hospitals, you get a pill for $40. You go to the drugstore, you get it for $10. Something is not
That's
balanced.
not the doctors. Come on, that's disingenuous.
No, but
that's disingenuous.
No,
you know that's not the doctors charging that. That's the insurance companies,
that's the
pharmaceutical companies, and the hospitals. That's
the
exactly right.
hospitals, healthcare.
That's exactly
that's
right.
The healthcare
I want to go back to
system.
one thing she said, though. Not only is her insurance premium gone up 50% based on what she said, but she's not even talking about her deductibles, which have also gone up 50 to 100%. So not only is the premium less affordable, the coverage is not affordable. If you go to the doctor, your out-of-pocket cost is unaffordable. A bronze plan under Obamacare covers what, 60% of your cost?
Yep.
So no, you're only looking at one aspect of the cost when you look at the inflated premium.
What we're going to do, I had an opportunity last week before coming here for this town hall meeting. I stopped by and talked to Congressman Trey Gowdy, who's another distinguished member of Congress from South Carolina. And this is what Congressman Trey Gowdy had to say about some of these very same issues that we're discussing tonight. Let's go to the tape.
Can government dictate that you purchase a private product? If the answer to that is yes, then you have fundamentally changed the relationship between the governed and the government. And if you can do it with health insurance, how about life insurance? To quote Justice Alito, how about burial insurance? I mean, you're not guaranteed to get sick. You probably will, but you're not guaranteed. You are guaranteed to die. So why not burial? Why not dental? Why not vision? Where does it stop? I don't want the federal government taking over state civil justice systems any more than I want the federal government taking over state criminal justice systems. But there is a conservative argument for tort reform, which is this. If it involves Medicare, which is federal money, or Medicaid, which in some instances is federal money, or federal prisons, or other hospitals that are connected to the federal government, then yes, there's a reason for Congress to get involved in tort reform. If it's purely a state doctor being sued by a state patient, then no, Congress doesn't have any business getting involved in tort reform. That's a state issue. So conservatives need to be consistent. If you like your health insurance, you can keep it. And for those who weren't paying attention, he said period on the end of it. So that was a demonstrably false statement. Then he gets into doctor. You can keep your doctor. Well, now people are finding out that you can't. So the partisan nature by which it was passed, this breach of trust between the governed and those we put into position that they would lie to us even for the purposes of winning an election and only for the purposes of winning an election. And then thirdly, okay, let's see if we can get past those 2 points. How's it going for you now? How'd you like the website? $500 million. How was that working? The promises that he made, the premiums and the coverage, were those kept? This notion that young people are going to flock to health insurance, how's that going? The enrollment numbers are nowhere near what they need to be for young people. So on at least 3 different levels, it is problematic for our republic. And I want to thank my colleague, Congressman Tom Rice, who's been a delight for me to work with and get to know. I wasn't sure that Congress needed more lawyers, and I know that Tom doesn't like to advertise that he is a lawyer, but very bright. Tom has a bill that is going to claw back Congress's power because of executive overreach. So if you see Tom, tell him thank you for his resolution where Congress stands up to the executive branch. He gets the balance the way the framers wanted it to be.
And we're back, Congressman Rice.
Yes, sir. Well, I think a lot of the points that we've said here tonight and what Trey Gowdy just said, Obamacare is just too expensive. We can't afford the cost to the government. One point we hadn't raised is it cost $1.4 trillion over 10 years. Added on top of a $17 trillion debt that our country already has. We can't afford the cost to the individuals. This lady's premium went up 50%, her deductibles are up 50%. We can't afford the cost in jobs. Another lady here, her hours have been cut to 28 hours because employers are forced to do that. We can't afford the cost in jobs when employers have to hold their employees under 50 people. We can't afford the costs in loss of freedom and loss of choice on what we want to buy. Because Mr. Alexander, Representative Alexander, you're incorrect about one thing. there are required minimum coverages under Obamacare.
Right.
One of them is maternity coverage. You will buy maternity coverage, or you will be fined. So the cost in all these aspects is just too high. I go back to say, though, that there was a problem. There was a problem that we have too many uninsured people, and that we need to deal with that. And this bill, H.R. 2300, Tom Price's bill, deals with that in a way that saves $2.3 trillion instead of cost $1.3 trillion.
Well, while Dr. Alexander is researching to make sure what you're saying is factual, we're going to go back, because I know that's what he's doing, and he did not deny it. So we're going to go back to the social media desk and to Tim McGinnis before we go back to the audience to see what's going on with social media.
All right, thanks a lot, Armstrong. We have a lot of great stuff coming into our Facebook page. Just go to Facebook, search News Channel 15, and you can find where to comment. If you're on Twitter, go to @CarolinaLive, the hashtag #YourVoiceYourFuture. We're hearing a lot of negatives about the Affordable Care Act. I just want to pass this on from somebody. I don't get it. I'm 57 and applied through the .gov website. My premium for $250 deductible with minimum copays is $102 a month. I estimated my adjusted gross income as $20,000. That's after your exemptions and things are taken out. I don't have a problem with mine at all. It was going to cost me $650 through Blue Cross 7 years ago. I haven't had insurance in 7 years, and now I'll have it. I'm a happy camper. So, Armstrong, it would appear that it's working for some people.
Thank you, Tim. Mayor Lovett, this is my opinion as the moderator. I think that if what President Obama promised in terms of if you like your physician, you can keep it, premiums will not soar. And even some people are saying that after the midterm elections in November 2014, we may see yet the worst of premiums soaring even higher. I think people really want the president to succeed. I think they really respect him. They really want to believe him. But I think it's not really about the president. It's about people and their health care, what they're faced, what the challenges when they go and try to sign up, and the premiums are soaring. And I know you support the president, and many of us support the president when we can support him, that is. But on affordable care, if you could do something differently with affordable care, because you're a man of integrity, you've been known to cross the aisle, what would you change that you feel that could enhance what you're hearing from this audience tonight?
Well, what I'm basically hearing from the audience and everybody is that this was partisan legislation. What we need in Washington is everybody to cross the aisles. First of all, it's the people that sent them there. And the Health Insurance Act, the Affordable Care Act, sorely needed. We all know we need it. But everybody wanted to play politics when this came up, instead of saying, let's do what we need to do for the people of the United States of America. So my message, as in any rollout of any new product, there are going to be some glitches initially. Part of it came from maybe not testing it properly and putting the proper mechanisms in place to make sure that once the healthcare market was open, that people could get into the system and the things that needed to be done in that aspect. But the bottom line is that we have people out there that are in need. Our job, the political standpoint there is that regardless if I'm a Republican or Democratic or independent, our first job is to take care of our citizens of the United States of America. And if this was done to begin with, and everybody quit playing politics of who's getting credit for doing whatever we're trying to get done, everybody could have compromised and they could have come up with the right plan that would have worked to begin with. As the congressman just said, he has a bill. There are a lot of other Republicans that have a bill, but everybody wanted to put their name on the dotted line to say, this is what I did, instead of saying this is what we did.
Thank you. Introduce yourself.
My name is Paul Norcross. I'm from North Myrtle Beach and from High Point. I guess for all the people that voted for it before they didn't read it, this is all about social engineering and really has nothing to do with health care. But if you listen to the people here tonight, they're talking about personal stories about getting crushed by this. Who are the people that are getting waivers and getting free passes and don't have to follow the system? and are able to skirt around it. Who are these people and how are they getting their free passes and why?
Well, that's one huge problem with this law, is that, in the first place, the law is somewhat still being written in the regulations. The regulations are, they brought them into a meeting one day and stacked up, 8.5 by 11 sheets. It was 7 feet 2 inches tall, 50,000 pages of regulations, which is still being written, so nobody really knows what the law ultimately is. But the second, even bigger problem is that the president changes the law at his whim on a day-to-day basis. He waived something else today. There are 1,300 exemptions. The president waives the penalties for his friends, but not for people who aren't his friends. He waives the penalties for the labor unions, but he enforces the penalties on the Sisters of the Poor. That's not the way our system of government works. That's not the way the Constitution works. Under Article 2, Section 3 of the Constitution, the president is charged to faithfully execute the laws of the country. He has no power. The law said that the employer mandate that businesses shall cover their employees effective January 1st, 2014. The president said, I'm just not going to enforce that. The Supreme Court had ruled that that was a tax. That penalty is a tax. The Supreme Court ruled that about a year ago. The president said, I'm not going to enforce that tax. Well, gosh, what does that mean? That the next president who comes in says, well, I just don't like any part of the Affordable Care, therefore I'm not going to enforce it.
Well, and that is what's happening. And let's be fair about it. I think the president has certain authorities and certain responsibilities as all elected officials in our particular areas. I don't think he's changing the law. He's amending the law. He's amending the bill. Let me finish.
He has no right to do that.
As you are about to do, as your bill is about to do, is amend the law, and that's part of the process. I think the mayor was right on point. I think the mayor was right on point. Is that we need to look at what's good for the country. 200,000 people
under the Constitution.
200,000 people here in South Carolina uninsured, and I can almost tell you three of us are beneficiaries of government insurance.
The legislature.
3 of us right here are beneficiaries of government insurance. And it's all right for us to have it, but you're saying it's not right for other people to have it?
No.
That's pretty darn good insurance, isn't it?
3 of us.
Yeah, it's pretty good
3
insurance.
of us on government insurance.
Y'all have good insurance.
Good insurance, too.
Good insurance.
So why can't other people have it?
Can Governor Haley write a law?
Because they didn't give it to them.
Can Governor Haley write a law that legislature? No, she cannot. Under our Constitution, we have a separation of powers. The legislative branch drafts the law. The president enforces the law. The president has no right to change the law.
I understand the governmental process.
It takes Congress to change the law.
Let's go back to the audience.
I have HR 2300. Excuse me, HR 442, which is what Representative Gowdy referred to, which is it's called the STOP resolution. Stop this overreaching presidency, just to make the president comply with the law. Because, gosh, even if it's written on the page, if the president can decide what parts he wants to enforce and what he doesn't, how do we even know what the law is?
We're coming back. There are 3 separate branches of government, and that's why we have a check and balance system in our government.
To protect our freedom.
Yes.
To protect our freedom.
Protect our freedom.
And we better be vigilant or it'll go away.
Yeah. What did you have to say? What's your name?
Thank you, Mr. Williams. My name is Rosina Nelson, and I am from Marion. And as you all know, I'm representing a very uninsured county of this state. I work for a company, nothing to do with politics. Pro or con, I came to find out the pros and cons of the Affordable Care Act. I don't like Obamacare word. I want to know real talk. We can discuss. I listen at things on TV. I've been online. I've gotten information in the mail. I still don't quite understand. I think a lot of people are fearful because they don't understand. That's number one. And you can say, not agree with me, it's okay. But I know that for a fact. I worked for one of the top paying companies in Marion County for 36 and a half years, took early retirement. It was promised to us by this company. This company is still in business. Our brand is out of business. So the company is still making lots and lots of money. They said if you work for me 36 and a half years, you reach 55, your insurance premium will be $64 a month. 6 months after I retired, my premium went up to $550. We contact the guy, had him to come in, an insurance agent, to sit down with us. We now own a little small business, network marketing business. There was something online you could get insurance for. Well, we had him to come in and talk. He said, yeah, you join a membership, pay $3-something a month, and that's it for Medicare, for major care, health care. We did that. It stayed there for about a year. Then it went up to $500. This was before the Affordable Act went into play. So I think my question is to you, and I keep hearing Medicaid, Medicare. Medicaid and Medicare are going to be taken care of. May not be on the way it is or has been, they will be taken care of. People will be able to go. There were 850 people working with me, baby boomers. Most stayed there over 35 years. Most are retired, can't get a job, are not insured. Those are the people I want to ask you about. We are the people. We work, we paid in, we paid our dues. We are the ones that don't have insurance. Are we poor? We thought we were middle class. We are poor. So it's the rich and it's definitely the poor. And we worked as middle class citizens and we are now really poor citizens. What can you do to help us?
Thank you.
Well, I'll respond if you'd like. You know, this is a problem that is occurring across states and counties and cities and governments and businesses everywhere. And as the mayor alluded earlier when he said people are paying into Social Security and they won't see their money. Didn't you say that, Matt?
That was that audience.
Governments have made promises that they can't keep. If we act on Social Security and if we act on Medicare and we do it promptly, the longer we wait, the worse the problem gets. But if we act to reform these programs now, we can make them solid for our seniors, and we must do it. We've got to make these promises solid for our seniors. Medicare will be solid, but we have to reform it. We have to do it. The quicker we do it, the less painless it'll be. The less painful it'll be.
You know what we want to do now, because out of respect for everybody who's in line, we just want you to state your question, because we have about 8 minutes left in the live broadcast, and then if we have time, we'll have our panel respond to you. So just state your question and make your statement. We're going to move the line pretty quickly.
Okay. My name's Tony Pruitt. I'm from Conway, South Carolina. I had insurance. I got the letter in the mail. They dropped it because I had to have all this other stuff, that the Affordable Care Act. I went online to try to get the Affordable Care Act. It was going to be just as high. So where does the affordable part come in?
Okay, next.
Well, I agree with you. As Forbes magazine said, the average policy in South Carolina go up 30 to 40%. Said men would go up as much as 90%, women in the low 20s.
Go ahead.
I took kind of a 40% pay cut. I'm on Social Security Medicare. Okay, Medicare doesn't cover anything because they're calling it pre-existing. But yet they cut my wife's hours back, and the medical profession is just like the car business. I just had cataracts done, and I negotiated in 4 states. Got it done for 50% less by going to Ohio. But I had to go into my pocket. You know, so there's no really affordable, because on the Medicare, they cut her hours back, so she can't get anything. I take a between 50 and 60% pay cut. She can't get anything through Medicare, through me. So, I mean, I could be in a box, and I'd probably do her better off, because she'd at least get an insurance payment.
Can I jump in, Armstrong? You know who loves this bill? Besides supporters of the president, and God bless the mayor and the state rep, they're doing as good a job as they can, you know, because they know this eventually is a losing battle, but they're doing a good job tonight. I respect them for it. You know who loves this bill? Big business, big insurance, and the big hospitals. They make a ton of money off of this bill. The insurance companies get to make a ton of money off of the new folks coming onto the exchange, and the hospitals are cashing in on the Medicaid reimbursements. Those are the folks that love this bill. You know who doesn't like this bill? The little folks, us. Folks that have to pay. You know, the gentleman that was just up here talking about how he's got to travel all the way to Ohio just to cut a little bit of cost off. We're the ones that get screwed on this deal. And that's why, hold on just a second, State Rep. Here's the deal. Again, we all agree on this state. We can all agree we want to try to have as much access to health insurance and quality health insurance, affordable health insurance as possible. I 100% agree with that notion. What we needed was an approach with a rifle, not a bazooka. We didn't need to take over, the government did not need to take over a sixth of the economy to help 11% of the folks. Well, that's the bottom line.
I'm glad to hear that you said that we need some type of health insurance, health reform. Because
we need access. I didn't say we need government health insurance.
When this discussion first came out, a lot of our friends on the right say there was no need, we're messing up, we don't need this, it's a bad thing, leave it alone, people are happy. Now I'm hearing folks saying, I'm glad the conversation is moving to that. We need to look at our we need to look at our health insurance plan and see how we can reform it to make it better, to bring the cost down so that everybody can be a part of it. I'm glad that discussion is being had. Now, whether or not this is the best plan out there, maybe not, but it is a good start, and some folk are benefiting from it. And as the process continues, remember now, this bill has been in place for 2 years. It did not just start in October. It's been in place for 2 years. So folks are benefiting from it. They are not talking about the good of the bill. The only thing we hear is about the bad.
Hospitals and big insurance companies are benefiting.
I know for a fact McLeod Hospital in Florence is going to lose $30 million whether this bill passes or not because of the reform. They're going to lose $30 million.
Big hospitals and the big insurance companies making a lot of money off this bill.
One thing,
we're going to go to the audience. We're going to get back.
The law came into effect in 2010. It's been in effect for 3 years. We had 3 years to plan to set it up. We spent $500 million, $500 million on a website to try to get the website to work.
That's a technical point. Let's look. That's technical.
It's only $600 million. Don't worry about it. Don't worry. We can afford it.
That'll take care of itself. That'll take care of itself.
I agree.
That was a check for $600 million. Let me write that right now.
But it is a perfect example of why big government cannot handle things like this. Yes, sir. Go ahead.
All right, here's my question. My name is Jerry. I am a licensed insurance agent. Have been for a while. Here's my question. How much of what we're hearing tonight is fact and how much is fiction?
I'm 100% fact.
Let me finish. There is at least one iPad on stage. When I came tonight, I took the average age of 51. I put in an annual salary of $25,000 a year, and the rate I got from the exchange with the subsidies was bronze $65, $75, silver $150 and $170. And that is a lot different from what other people are seeing. So the reason I bring up the iPad is because it's very easy to look up some of the numbers and the age, and I think people need to do that. I know that maternity is taking a beating here tonight, but you really need to dial down and understand what's under that umbrella of maternity as opposed to, I'm a guy and I hate it, why am I paying for it? I think people really need to start doing some research and not take a lot of what you're hearing because some of the information is fact and some of it is fiction.
Well, let's talk about the quality of care because that's the most important argument in all this. We can talk about costs. We can talk about costs all day long and the deficit and the debt.
Let me just have you to tone it down a minute. Let me finish my audience. I'm going to get back to you, my brother. I know you got on fire.
You got it.
But let me quell it a minute. Go ahead, my brother.
Thank you.
Yes, you're welcome.
Dennis James, Myrtle Beach. I'm concerned about two things. One, why didn't the government take the same policy that we were asked to have? And I never see that ever brought up in explanation. And secondly, what kind of safeguards are in place to quit from spending too much money on health care? I mean, it's getting out of control. And you're seeing hospitals and everything get deeper and deeper in debt and having to raise their prices more and more. Nobody has got any regulations in place to protect us from eventually the policies are going to have to go up and up and up, just like the situation we got now.
I'd love to take that if I could.
One last point, and we're going to get you in.
Can I answer his question?
Oh, you will.
Okay.
Don't worry, you will. Trust me, you will. Go ahead. Your name and...
Jesse, I'm from right around the corner. We heard a gentleman tonight say that he was able to be covered with a pre-existing condition where that wasn't possible for him before. I have a personal friend whose policy was canceled because of Obamacare. It didn't meet the mandate dictated to us by our president, and it was canceled. She's got cancer. And she tried to sign up on the exchange, and it was 3 times what she was paying. She can't afford it. Now she has no insurance. My question is, isn't there something fundamentally wrong with a program that has to hurt person A to help person B?
Gentlemen, you have the floor.
Well, in response to her question, again, 150,000 people in South Carolina lost their insurance as a result of the Obamacare. 24,000 people signed up on the exchanges. If our goal was to cover more people, we're backing up. Going to his question about health care costs, I agree that Obamacare does nothing to control the cost of health care. This bill, H.R. 2300, does. It reforms medical malpractice to drive down the cost so that doctors don't have to practice defensive medicine, and it allows insurance companies to compete across state lines to increase competition to drive down cost. Second thing, with respect to preferred plans, you know, under the Affordable Care Act, it specified that members of Congress and their staffs would go on to the exchanges, the Obamacare exchanges. We had this shutdown in October, and Harry Reid went right to the wall on, you know, the last thing that was proposed to him was, look, just delay the Affordable Care mandate for individuals, just like he did for businesses. Delay that for a year. Treat individuals, the common guy, like you do the businessmen and the business owners. And he said, no, absolutely not. We're going to put this in effect just like it is. Of course, they're changing it every day. But when it came time to buy the insurance policies, to get on the exchanges, Harry Reid and his staff, they didn't go on Obamacare. Yes. Good. They forced it on us. Is it working? They forced it on us.
Is it working?
I don't know. I hadn't used it yet.
Okay.
they forced it on us, and then magically, about the middle of December, we got a memo that congressmen can designate who working in their office is on their staff or not.
Hold that, Congressman, hold that for me.
They have to go on Obamacare.
Congressman, this is a hard one for me.
Okay.
So look, we want to say goodbye to our CW21 audience, and thank you so much for joining this incredible debate. Fantastic audience, fantastic panel. We're going to come back much more with Carolina on live.com. We're going to continue this debate. It just won't be on my new CW21, which I happen to own now. Wow, what progress in America. Good day, everybody. Thank you for joining us. And when we come back, much more of this town hall debate. Well, no, we're back. What miracles? Okay, Congressman, now you can go for it.
Okay, well, all I was going to say is Congress was given the option to designate that's working in the congressional office was on their staff or wasn't. Now, how you can say that somebody working in your office is not on your staff, I don't know. But if you designated them as not on your staff, they did not have to go on the Affordable Care Act exchanges. If they were on your staff, they did. So of course, I designated everybody in my office was on my staff. I don't know how you could say otherwise. And everybody in my office, including me, is on the Affordable Care Act exchange. I could not, with a straight face, tell you that you had to do that and me not do it.
Wow. Wow. You know, did someone else, we can take more questions from the audience, but I want to do something a little different. Mayor Anderson, you're such a gentleman. I think you're just such a gentleman. But we need all kind here tonight. We need everybody. We need everybody, but we really appreciate you. Not that we don't appreciate everybody else, but you're a gentle giant. Okay. But here's what I like for you to do. I like for you, Mayor Lovett, we're going to have you guys ask questions among each other for about 10 minutes because there seems to be a lot of fire and misfires here on the stage. So I want to give you a chance to ask David Swart a question after you've been hearing him for the last hour.
Well, what I'd like to ask him is the gentleman that came up that was the insurance agent made a very pertinent point in regards to the different levels of care. You know, when we're discussing openly like we are, everyone is trying to get their little uppercuts in and everything else. But what I look at is there is a definite plan out there, and they're at different levels. And as one other person said earlier, there's just not enough information given to the people that really want to see how this system will work. I agree. that yes, there are some enhancements that need to be done. But I think we all have agreed on the fact that we need the care. There are people out there that are struggling that really need to have health care. So regardless of what our personal sentiment may be in regards to the Affordable Care Act, how do the four of us, per se, if we were all up in Washington, how do we come together to fix it?
Well, I would tell you, and Merritt's a great question. If the four of us sat in a room together and we were in charge of trying to fix this, you know, what's going on and trying to help get more folks access to quality, affordable care, we could probably do it. You know, you throw in, and Congressman Rice knows this, you throw in, you know, 450 folks from around the country, and like you said, everybody wants to take credit for this and take credit for that, and that's when you start to get the partisanship and you know, a lack of agreement. But I would tell you this: the thing that really is personal to me, and the thing I think is we really need to work on in this country with healthcare is keeping that quality of care that each one of us expects to have. When we go to the doctor, and you know, we had a family doctor. When I grew up, we all went to Dr. Graham, and Dr. Graham was a trusted family friend. He was our family doctor. He was my grandmother's doctor. He was my dad's doctor. He was my mom's doctor. He was, when we got old enough out of the pediatrician's office, he was our doctor. And we trusted him. And I think we need to make sure that we keep that doctor-patient relationship as close together as possible. That is, I think, more than anything else, that access and the doctor, the closeness of the doctor-patient relationship, that has to, once we lose that, then we go into, and I say, you know, a single payer system or you know, a system where, you know, you don't know who your doctor is. You may have to travel a length to get, you don't trust your doctor. You may have to travel far lengths to see a doctor. And I think that breaks down the entire system. So what we need to do, in my opinion, if we're going to fix and allow more, you know, access to quality, affordable care, we need to make sure that we keep that doctor-patient relationship. I think I think we can all agree on that. That is the most important concept to healthcare: is you know who your doctor is, you trust them, and they can help you.
Now, just an ad-lib on that. And I like the fact that you said the patient-doctor relationship. Now, I'm from a small country town, Lake City, and I can grant you that I know folk that probably have never been in a doctor's office. They don't have any type of insurance or anything to help them get that relationship that you have. You know, we always know that an ounce of prevention is worth a pound of cure. And when we look at what's going to tax the system and probably raise costs unless we do something to stifle that, is what we're talking about now, is there are so many people out there that don't have health insurance, that really need it. And preventative medicine, which we all get, is a key to maintaining that health system. How do we get those folk involved that currently have no way of really getting into the system?
Well, like I said before, it may be an oversimplification, but I honestly believe that the thing that will solve the problem and solve just way more than healthcare in this country is we got to get people back to work. There are not enough people working. We don't have job creation policies in this country, because when folks are working, they have much higher access rates to healthcare and quality healthcare.
Well,
and right now we have a third of the country that's not even in the workforce.
I agree that jobs are important, and that's my #1 focus in Washington. But I also agree with you that alone is not going to get everybody health insurance. But I also believe that Obamacare is not the way to get everybody health insurance either. I think the plan is fundamentally flawed. I think rather than coming up with a plan to specifically address the 30 or 40 million people that weren't insured, instead of doing that, we essentially have a government take over the healthcare system. And we're requiring everybody to buy an insurance policy designed by the government, rather than you deciding what type of insurance you need, or you, or you, or you. Everybody's going to have to buy the same exact insurance overall plan. Now, they can take a bronze, silver, or gold, which covers different levels, but they're all going to have to buy the same plan, and it's not going to work. it will not. It will fold. The numbers will not work.
Representative Alexander, I'm gonna have you ask a question of Congressman Rice.
My House district sits right in the middle of two major hospitals in the PD, McLeod Hospital Health System and Carolina Health System. One of their
Great hospitals.
One of their main issues, one of their main concerns, are keeping individuals out of the emergency room. That's one of their main issues. If we can keep folk out of the emergency room, and that has been a major factor, not only here in South Carolina, not only in Florence, but across the diaspora of this country. If we can keep people out of the emergency room, those individuals who do not have health care but need health care, what do we do about those folks who have no other recourse but to go to the emergency room? And when you go to the emergency room where you're getting free medicine, and that cost is being passed on to those of us who are working, what do you do about those individuals? How do you keep them out of the emergency room?
Again, you do a targeted plan to actually insure the 30 or 40 million people that are uninsured. And the plan, HR 2300 says, again, Medicaid covers the people on the lower end. The wealthy people can take care of themselves. The people who work for companies that provide insurance are covered. We have the rest in there in the middle. And HR 2300 provides a sliding scale of tax credits that they can choose to go and buy whatever insurance policy they want.
Is that a federal mandate? That would be a federal mandate?
There's no mandate.
No,
they get a credit, and they can decide if they want to, you know.
But will your bill mandate that they do that? That they have to get a tax credit?
No, but they get a tax credit to do it. So it's their choice.
Who are they? Who are they? The people who don't have insurance?
That be up to a certain level. You know, at the lower end, just above Medicaid, it might pay for all their insurance.
Well, what about those who are not eligible for Medicaid?
Again, that's what I'm talking about. People who are not eligible for Medicaid, okay, on the very lower end of the scale, they get a higher tax credit that pays for much, if not all, their premiums.
That sounds like a federal government intervention as well.
There's no mandate. They don't have to. They don't have to do it.
But the federal government would pay for that.
They would get a tax credit, and they could decide what kind of policy they want.
So
and if they want to buy a major medical catastrophic policy, they can do that.
So you're saying
and if they want to buy a bells and whistles policy that covers maternity and substance abuse and mental health and all these things,
so you're saying we're exchanging
they can do that too.
We're exchanging one federal mandate for another federal mandate.
That's not a mandate.
One federal program for another federal program.
Which costs $2.4
well, we don't know that it works.
Which costs $2.4 trillion less.
Well, we don't know that it works, but we're still saying government intervention. We don't know, and I think if we just wait, I mean, this Medicaid expansion has been in existence, what, 6 months, 5 months, something like that. You know, of course the bugs have not been worked out, you know, technically or otherwise. And I think if we just wait a little while and see and make the adjustments, whatever those adjustments might need to be, you know, whether it's your bill or some other bill, make the adjustment. But I'm glad to hear you saying that we need to do something, and that's my concern. 200,000 people here in South Carolina uninsured. A lot of them are going through the emergency room, which is raising the cost for me and for you, because they do not have insurance. I'm glad to hear you say, let's take a look at that. Let's see how we can get as many folks insured as we possibly can to lower the cost.
Obamacare will not do it.
To lower the cost. I think it's working. I think it's doing some of those things. Thank you, sir.
Let's go back to the social media desk and Tim McGinnis give us an update. What are we hearing?
All right, Armstrong, we're hearing a whole lot on the social media desk. People are going into Facebook, searching News Channel 15, and leaving comments there. They're also going to Twitter, @Carolina Live, hashtag Your Voice, Your Future. Here are a couple from Twitter. Laura Elliott says, I work. My employer cut our hours. They blame the Affordable Care Act. I blame it on greed. Todd said, as a physician, reimbursement continues to go down while premiums go up. Let's take one that just came into Facebook. This is from Diana Gore. She says, question being asked for my brother-in-law. I'm mid-40s, disabled, been turned down for Social Security, disability twice, no income, no insurance, and was recently turned down for Obamacare. How is this possible? Thought this was for everyone. How can someone in my position get affordable insurance? Great stuff coming into social media. Keep it coming.
Thank you, Tim. You know, we're gonna wrap this up because we're gonna get into the live to tape of our programming here tonight, so we can sort of get you out here a little earlier than you probably thought. And if any of you want to leave before we start the show, don't feel like you're going to hurt my feelings. I understand, okay? So don't feel like you have to stay. I want to recognize the Congressman's wife, Rennie, who's just been a gem to work with. It's a wonderful person.
Stand up, boy.
Stand up, Rennie. Yeah, she's just been a gem, a jewel. She's my ally. She's my secret weapon to get into Congressman here.
I wouldn't be in Congress but for her, and she cares about people.
Yeah. Well, I'm sure all your wives and, you know, and you say the same about your wives. You know, I want to say this. You know, I thought the passion, when you listen to some the questions and statements, I mean, it is just really amazing that something can go from $64 to $590 a month. Because the problem with that, you don't factor that in your overhead during the month. We talk about fiscal responsibility and managing your finances. I mean, listen, if you're talking about, and you're going to find out that you're going to go from $64 to almost $600 a month, I mean, first it takes you a couple of months to get over the shock before you can start addressing it. That's the first problem. I mean, how could that possibly be, though?
My friend, think about this. Think about this for a minute. In 2009, gas was $1.80 a gallon. Okay? The war on coal is going to cost the average consumer $40 a month on their electric bill. The gas thing will cost the average, going from $1.80 a gallon to $3 a gallon, cost the average consumer about $100 a month. The war on coal, $40 a month. Obamacare is going to cost the average consumer about $200 a month. The payroll tax extension, the credit or the holiday just went away. It needed to go away, but it just went away. That cost the average worker $90 a month. The federal government is putting on people. And Obamacare is just the latest iteration of that. You know, when we say we're for the middle class, but we're charging the middle class an extra $400 or $500 a month when you add it all up. You wonder why the economy is straggling. You know, 2/3 of the economy is based on consumer spending. When we're taking $400 a month out of the average consumer's pocket, and you wonder why the economy is struggling, you wonder why employment is low.
Well, I don't know if you want to put all that on the Affordable Health Care Act. That the economy is staggering. I mean, it's been staggering for the last 5 or 6 years. As a matter of fact, it's going up. I think that's what you're.
I'm going to give everyone to make a closing statement.
Okay, so it's going
and
up.
I know you're going to take as much time as you want. I'm not going to put any time constraints on it. We're going to start with you, David Swartz. Your final thoughts.
Well, again, I think this is an issue that so many people are passionate about. I'm passionate about it because it's so personal. This is our health care. Like I said, when I was talking to the mayor, I mean, this is our doctors. This is, you know, God forbid something tragic happens to either ourselves or our families. We want the best care that we can possibly have. If I have cancer, I want the best cancer doctor in the world operating on me. The intervention of Obamacare and the inaction of Obamacare, I think, you know, and again, I just believe it will destroy the doctor-patient relationship. And that's really what it comes down to. The costs, I get it. That is an argument. It's a valid one, and we can argue all day long on what the costs are and the debt and the deficit. It's the threat of the quality of care. It's the lowering of the quality of care because of this law. And that's what really concerns me. That's what I'm passionate about. And I just don't think that this law will increase the quality of care. I think it will dramatically lower the quality of care.
Mayor Lovett Anderson.
Well, what I look at in the Affordable Care Act and its intent and its purposes was that there is a large segment of our population that is in dire need of health care. There are people that are in rural areas as well as urban areas that don't get any preventive care or anything. And we realize, as Representative Alexander said, that hospital emergency rooms, they stay backed up. Look at the areas that don't even have hospitals. There's no place for those folk to get care. We as a nation, the greatest nation in the world, should be able to come to some sort of agreement on how we're going to work with those that really need medical health care. When in the early days, my grandmother knows we're growing up, they didn't have access to a doctor. If you were sick in Florence County and you really had a major illness, you had to go to Charleston. Remember that? That's a long ride to be away from your family and people, your network. Nowadays, we do have two great major facilities in Florence with Carolinas and McLeod. So it has gotten better. And then in rolling out the Affordable Care Act, in any new project that is done in regards to something of that magnitude, there has to be testing done, there has to be standards raised in regards to how it's going to work before you even turn the system on. I truly think that the president's staff gave him a bad deal because they didn't do their due diligence before rolling it out. Working for Blue Cross for all those years, whenever we got changes or had changes that came into effect, there was system testing. Can it handle the load? You know, when they opened the floodgates up and everybody started calling, the system got overwhelmed. There should have been people that know the mechanics of how this works. They were supposed to make sure that that did not happen. And that was a failure in the system. And that caused everything to go off, offline. And then if I'm a person and I'm out there and I really need to get into the system, and you tell me it's tied up today or the system has gone down, I'm gonna get frustrated, I'm gonna get agitated, and then I'm just gonna really get mad because I really want the product that I'm trying to get to. Well, identify with those people. The idea is a great idea because we need to have something in place. I think what bothers me the most is that there were many that didn't step up to the plate to work on this idea, to say that we as a Congress, we as a nation can get something like this done. We're considered the nation in the world that everybody else wants to come to. Then you mean to tell me that we can't solve the things that are important to our citizens? We must stop being so self-centered and begin to be problem solvers for all of us on the norm.
Thank you. Representative Terry Alexander.
Thank you, Mr. Armstrong, for hosting this and for making this possible for the people in South Carolina and across your channels there. But let me say that I'm glad we're having this discussion. I'm glad to hear that there's some alternatives out there to ensure those individuals who are not insured be given that opportunity. And I think that was the intent of the Affordable Health Care Act, to look at health care from a holistic perspective and see what we can do to ensure those who cannot or were not able to be insured. So the discussion is good. If nothing else comes out of the Affordable Health Care Act, Obamacare, it's the idea that we are now looking at health insurance for the least of these. And that's what this country is all about, for the least of these. And so that's a good thing, number one. And number two, I would hope that we here in South Carolina will embrace this. We'll go to our government and say, let us look at what other alternatives we have to make sure that these 200,000 plus people in South Carolina be given the chance to get insurance, just like the rest of us here. And that is my whole goal, and I'm hoping that this discussion will lead us to this. Not only this discussion, but other discussions as such. Not just condone and kill and say it's a bad thing, but look at what are the alternatives. Look at the amending of this bill to make sure that everybody be afforded what you have, and what I have, and what you have, and what you have. Everyone deserves that. And not only will that be good for business, but it also lower the cost. So that means that the cost across would be spread. I'm hearing it all the time from McLeod Hospital that, hey, if we can keep them out of the emergency room. If we can keep them out of the emergency room. Folks coming in with no insurance. You can't turn them down and say, we can't serve you. If we can just keep them out of the emergency room. And this is a way, this is one tool. Is it perfect? No, by a long shot. No, it's not perfect, but it is a starting point. And I think history will dictate that in the long run, that's been a good discussion point to move this country, this great country, to where other countries who are less than we are, where they are in terms of healthcare delivery.
Thank you, Representative. Congressman Rice.
I think the mayor and the representative are wise men, and they've said some wise words. And I agree with the fundamental issue that we can't have 30 million uninsured people out there that can't afford insurance. All right, there's got to be a mechanism to do that. And I've co-sponsored this bill. I'm frustrated it hadn't come to vote. I wish it would. And I agree that it went unanswered for far too long, and the outgrowth of that was the Affordable Care Act. That being said, the Affordable Care Act is not the answer. The mechanism, the framework of the Affordable Care Act is unaffordable, it's unfair, and it's unworkable. That's the bottom line. And what we need to look at is one of these alternatives that truly does target those 30 to 40 million uninsured Americans.
Thank you. You know, we really want to thank Horry Georgetown Technical College for making their facilities available for us to host this very important meeting tonight. We really want to thank Greg Marsani from Sinclair Broadcast, who came in and got the great vision to make this possible for us, and also the general manager of WPDE and WWMB, Billy Huggins, and his fine staff. Really, there's just so much work. The camera people, there's the law enforcement who's here to make sure that nobody get crazy on us in here tonight. You know, when there's law enforcement in the house, everything is calm. You know why? Because we know they're carrying. That's a good thing. Okay, so we want to thank them. And it's just been a peaceful, and you guys are just the best. You're just outstanding. We thank you for coming. We hope you stay around for what's going to be a real quick 30-minute show. A lot of surprises, few surprises. But listen, we want to thank all of you. And Tim McGinnis, last but not least. Yes. Yes, Tim. You know, you got to spread the love. You can't keep it all to yourself. You got to spread the love. I got to spread it to my brother. Tim, fantastic job on the social media desk. And to the guys in the house that you cannot see, the production team, thank you guys. And thank you for joining us for this edition of WPDE and CW21 under, what is it? New ownership, baby. Hey, I like that. All right, good night, everybody.